Just like all of you, the Bear River region has experienced a tidal wave of impacts due to COVID-19. We have seen numbers rise by 60% in our domestic violence shelters, and major outbreaks in the area have caused housing instability for families who are already experiencing financial strain. In response, Bragg has streamlined their application for services to reduce as many barriers as possible for clients affected by COVID-19. They have started several new programs, including HAP and street outreach, and they have been a key leader in forming and engaging diverse stakeholders that make up the Bear River COVID-19 Relief Coalition. This coalition meets weekly to discuss community challenges, needs, and solutions. Our area is thrilled to have received funding to respond to system gaps through outreach and a scaled-up motel voucher emergency shelter program at Cache Valley Veterans Association. As our community has responded to the challenges of COVID-19, our LHCC has witnessed important growth. In May, we adopted a regional homeless plan aligned with state and federal strategic plans, and our LHCC has restructured, inviting new voices to the table and opening up doors to creative solutions to respond to homelessness in our community. We're excited to see where the next year takes the Bear River LHCC.
The Carbon-Emery Local Homeless Coordinating Committee has been working with local and non-local agencies during the pandemic to ensure the rental assistance program runs smoothly and our community members are assisted as quickly as possible. Many new partnerships have been established throughout COVID-19 pandemic. Our community partners have been a great support, displaying efficiency to those in need. Everyone has come together to coordinate services and ensure our community members have the best care possible. The LHCC has recently gained 2 new members that are passionate in serving those struggling with homelessness. They recently started providing hot meals to those in need every Friday at Heritage Park. They plan to further expand their outreach in the future. This is new to our rural community, and the LHCC plans on volunteering and implementing new strategies to improve the lives of those struggling with homelessness. The ESG funding has made it possible for multiple members of our community that were struggling with long-term homelessness to establish connections, create and sustain new lifestyles, and open doorways for new opportunities. There have been many success stories that the ESG funding has played a primary role in. Without this opportunity, we would still be facing barriers and gaps in providing services to those in need.
Here in Davis County, I inherited a tradition of collaborative work with agencies who help people avoid homelessness and also deal with homelessness and resolve it as quickly as possible. I would say that the pandemic has shed light on how quickly the status in the county can change, and it has very much helped us in a way to step up our game. So we have Davis Behavioral Health, and we have Safe Harbor Domestic Violence Shelter, and we have our community action agency, Open Doors. And everyone has had additional stress during the pandemic. So it has actually been an opportunity for us to find our gaps and to do even better working together. We have very much appreciated the help from our state and the additional help from our federal government, because during this time, there have been more people who are more vulnerable to homelessness and who have needed help to avoid it. So I guess we've had a very difficult situation actually help us become better and stronger. And I'm actually quite proud of the Davis County Local Homeless Coordinating Council, because we have a history of collaborating and communicating with one another, supporting each other, and we've had to even step up our game and become better.
Some highlights for Grand County for this past year have definitely been finding new and innovative ways to provide services for people experiencing homelessness here in our county. Our office could not be open to the public to reduce the interaction and encourage the social distancing, but we purchased some phones that we put out on our patio so we could still interact with clients who didn't have telephones. That was really, really critical. We put also an iPad outdoors so that could help people who are able to navigate the internet to have that free. Our community has a wonderful library, but during the pandemic, it was also closed. So we had a lot of the homeless population that typically goes to the library, having them at our center as kind of a temporary solution for having a place to just sit down, maybe check email and get on the internet. We also saw the biggest increase we've ever seen in our food pantry. We have never seen such a need for food and emergency supplies, infant supplies, medical supplies ever. And it was really heartwarming to see our community step up and really come together to find solutions for those situations. And we fed a lot of people, and everybody is trying to do the best they can as we all get through the next phase of this crisis.
Iron County Care and Share is located in the Iron County Local Homeless Coordinating Committee, and we're part of the Balance of State and proud to be so. Iron County is a rural community. Our population is about 60,000. Our poverty, unfortunately, when you look at the list of counties in Utah, we're in fourth from the bottom. So we'd like to get out of that spot. So I think by concentrating with our LHCC and the community partners, we're going to be able to address poverty, homelessness, and hunger. Our focus obviously is our friends living in homelessness. And so our committee, we have a really diverse group of committee members. We also have some community folks that show up to every LHCC, which I think that's tremendous. And we have made the focus of what we do the state strategic plan on homelessness and use that as a template and a guide to the work that we do and how we approach gaps in the community, funding in the community, and looking at it holistically. So our community really has made a commitment to make homelessness rare, brief, and non-recurring.
Like many communities around the state, we've had a tough year due to COVID. In Utah County, Summit County, and Wasatch County, we've had to improvise, adjust, and get creative. I could tell you how we've reduced our chronic homeless list by 50% in the last year. Or I could tell you that we have fewer than 10 homeless veterans in our community left to house. I could tell you about the collaborations and new projects we're engaged in. But what I want you to know is that in our counties, we have some of the most dedicated, caring, and innovative staff in the state. During this time of COVID-19 craziness, our frontline staff have stayed at their posts, continued to care for the homeless, and collaborated on ways to keep our vulnerable safe. They have sacrificed and gone far above the call of duty because of how much they care for people in our community who experience homelessness. In short, in Utah County, Summit County, and Wasatch County, we have more than social workers. We have heroes.
My name is Rob Westman. I'm Executive Director of NAMI Utah.
And I'm Jean Hill, and I am a co-chair of the Salt Lake Valley Coalition to End Homelessness.
The Salt Lake Valley Coalition to End Homelessness was officially formed in April of 2019 and is a continuation of the work that was being done by the Salt Lake Continuum of Care and the Salt Lake County Collective Impact Group.
And the goal of our coalition is to work together to make sure homelessness is rare, brief, and non-recurring.
Some of the immediate work of the coalition when we started included developing a strategic plan that was complementary to the state strategic plan on homelessness. And we also work with the Utah Homeless Network to develop and implement statewide strategies to end homelessness.
Specifically in our community in Salt Lake County, we've worked to stabilize and support a new crisis response and resource center system. This has included capacity management, overflow planning, housing integration, and implementation of COVID-19 safety protocols, as well as other strategies to increase housing options for those experiencing homelessness.
The Salt Lake Valley Coalition to End Homelessness continues to expand its membership to include all interested parties as we work to develop community-based solutions that will end homelessness in Salt Lake County and the state of Utah.
And we want to thank all of our participants and providers and everyone who has become a part of the coalition as we work together to address the needs of those experiencing homelessness in our community.
Hi, I'm Mac with the San Juan County LHCC. We are a newly formed LHCC for the state of Utah. And really, we had enacted our bylaws. Our county commissioners passed our bylaws to form this LHCC in the middle of COVID in response to kind of county needs that we have here in San Juan County. Prior to that, we had been working our housing and some of our programs through southeastern Utah, and realized and recognized that we would rather offer those programs here on a local level instead of having our citizens have to travel out to Price. So because of that and offering programs locally, we stood everything up to get going so we can kind of get the formation going with our LHCC, get some membership in the county, and then begin offering the programs throughout and continuing forward.
So the Tooele County LHCC, I'm so proud to be part of this wonderful organization. We have had great collaboration amongst many service providers in the county. And one thing that I think about recently that's happened is the success of intervening in the life of a veteran who's 77 years old, who came to the food pantry to get an order, and we noticed that his clothes were soiled and that his hygiene was horrific. When I asked him if he had access to a shower, he said no, he just had a hose. And of course, this inspired more questions and concerns for him. So working with members of our LHCC, the health department, law enforcement, aging services, and the Community Resource Center, we have been able to make contact with Veterans Affairs, who is now back on our LHCC. And we have made great plans to provide services for this wonderful man. We will be getting him housed and in a place where he has access to medical care and treatment and just what he needs. He was living in his car, homeless on his property, and soon he will be housed and safe.
6 County Association of Governments has recently recommitted to identifying homeless needs and strengthening low-income services in the 6 County area of Millard, Paiute, Wayne, Juab, Sevier, and Sanpete counties. Our services align with the CSBG plan, goals, and usage. Current programs are supplemented by funds which help to provide safe, healthy, and affordable housing for low-income individuals, prevent homelessness by offering rental assistance, and improve the quality of life for low-income families and individuals. Our counties have a very large area making up of nearly a third of the state. Our population is widespread and sparse, making it hard to provide adequate services to all our residents. Our high poverty rates cause additional challenges. For perspective, 9% of the state's population is at poverty level. The 6 County population averages at 13.1% poverty level. 6 County AOG has 3 community action offices with 12 staff who strive to improve the lives of our community members. The challenges of COVID-19 has overwhelmed our workloads. This renewed commitment to serve those most at risk of homelessness has brought in rapid rehousing and homeless prevention projects. However, it has also brought into full focus lack of affordable housing that many other areas of the state struggle with, reflecting the desperate need of housing resources. As we administer these programs, we are working to build trusting relationships with those we serve and partner with.
I am representing the Uinta Basin LHCC, which covers Uinta, Duchesne, and Daggett counties. Throughout this COVID-19 pandemic, our LHCC has put our focus on ensuring that the low-income community members in our area were still able to receive the needed resources safely. We did so, for example, by turning our food pantries, our senior centers, and our VITA services out to curbside delivery. We then focused on making sure that we prevented as many evictions as possible. Due to the loss of many jobs or the cutting of hours throughout the pandemic, many of our community members were on the verge of becoming homeless. So first, we worked together to provide as much information as possible to all renters and landlords on how both the first and the second moratorium worked and who it all covered. We then ensured that our area was able to receive as much COVID rental assistance funding as possible, such as ESG, HAP, home services. We then decided to have our local association of governments implement those programs, and they've been working very hard in reviewing and approving numerous applications for rental assistance, and then also referring those individuals to other resources needed to make sure they were okay. And then last but not least, one of the greatest things that we did was continue an initiative that we had started before in building a garden next to our pantry in Vernal. So we weren't sure if that was going to happen, but together we all came together as a community and was able to build, plant, place 13 garden boxes, and was then able to produce hundreds of pounds of fresh, nutritious produce to our pantry clients.
Hi, from sunny Washington County. Our local homeless coordinating council report is that we captured a lot of our strategies and goals for this 2020 fiscal year, and it really helped us align with what the state's doing, what we needed to be doing, and to adjust and make those changes as Washington County Local Homeless Coordinating Council. We also were able to pivot and open up a quarantine hotel in a 2-day period. And that was because we were able to communicate and involve a lot of different agencies to come to the table. So City of St. George provided the hotel, and the hospital provided medical assistance, and Fife County helped with some transportation monies, and Switchpoint helped with staffing and food. None of us thought it would go on this long, but it just speaks volumes of how well our local homeless coordinating council reacted to the COVID situation. I think our highlight for local, for the LHCC in Washington County was our ability to communicate. We brought on a lot of new members this year into our council, and we figured out great ways to strategize and come together, write grants together, and really focus on the problems as a group, as a whole, instead of us an individual basis. So that's the news from sunny St. George.
The Weber Morgan LHCC is comprised of roughly 40 agencies across sectors, including city and county elected officials, direct service providers, school districts, advocacy groups, the public health department, human services, and law enforcement. We have undergone significant changes in the last year, including Weber County hiring a coordinator to help the LHCC implement the state strategic plan on homelessness. We established a governing board for the LHCC to foster greater collaboration at the board level between our major homeless service providers, and we created bylaws that will govern our LHCC moving forward. Our COVID-19 emergency response has included a robust partnership between Weber County, Weber Morgan Health Department, and Weber Human Services to operate a quarantine and isolation facility for people experiencing homelessness. All of our emergency shelters are operating in the red phase to protect their clients and staff from the virus, and we actively work with our providers to ensure they know how they can potentially access funding to assist them with their crisis response. Moving forward, we are considering the long-term recovery needs of our providers and people experiencing homelessness, which includes continuing to develop cross-sector partnerships, maintaining a holistic approach, and utilizing an upstream and prevention lens as we move forward with making homelessness rare, brief, and non-recurring. Thank you, and I hope you enjoy the summit.
Over the past 6 months, I've had the great privilege of chairing the Thursday morning meetings with Tricia Davis, with all of the LHCCs, and I just have to say up front, they are the most amazing group. They're very pragmatic, they're very innovative, and so very compassionate. I just love the way they're reaching out to one another. The collaboration that has been going on over the past 6 months, it's increased tremendously. I love their ideas and their thoughts that they've been sharing, but I think they have done incredible work in preventing the COVID-19 virus spreading, in protecting many of our homeless friends, and in keeping people reasonably healthy. And considering how much our homeless friends want to move around and go where they like, I think the job that the local homeless coordinating committees and all their providers and staff have done is absolutely amazing. It's fabulous, really. I love the friendliness of the group, the warmth of the group, but I think we've learned a great deal from one another, and that's what I think has been so helpful. But the acronym team, together everybody achieves more, I think that's applying more and more to the LHCCs than they were, say, a year ago. And it's all to everybody putting in a tremendous amount of effort. And I'm grateful for that. And I just want to thank you all.